One gene mutation that's received a lot of press recently is in the BRCA1 and BRCA2 genes. Cancer.gov defines the genes as genes that produce tumor suppressor proteins. These proteins help repair damaged DNA and, therefore, play a role in ensuring the stability of the cell's genetic material. When either of these genes is mutated or altered, DNA damage may not be repaired properly. As a result, cells are more likely to develop additional genetic alterations that can lead to cancer. Specific inherited mutations in BRCA1 and BRCA2 increase the risk of female breast and ovarian cancers, and they've been associated with increased risks of several additional types of cancer. Together, BRCA1 and BRCA2 mutations account for about 20 to 25% of hereditary breast cancers and about 5 to 10% of all breast cancers. Melissa Etheridge found herself in hot water after misspeaking about having the BRCA2 gene mutation. She was quoted in AARP magazine as saying, "I have the BRCA2 gene, but don't encourage women to get tested. Genes can be turned on and off. I turned my gene on with my very poor diet." As we've explained earlier, genes cannot be turned on or off. The specialists at the Florida Hospital Waterman Digital Mammography Center explain the BRCA gene mutations and the importance of genetic testing.
The BRCA gene is a genetic test that is done to determine if you have that genetic type of composition that kind of makes you more predisposed to breast cancer. The guidelines for screening mammography basically say that the patient should come from the age of 35, and if the mammogram is okay, come from the age of 40 every year. That's per the American Cancer Society as well as by the American College of Radiology, otherwise known as the ACR. If patients have breast cancer in their family or have a positive BRCA gene, they're asked to come from the age of 30 and then 35 and then start at 40. After the screening mammogram, if your screening mammogram is abnormal, then you have something known as a follow-up known as a diagnostic mammogram, where we'll be doing extra images as well as a possible ultrasound or MRI follow-up. And after the diagnostic workup is complete, we discuss the findings with the patient. 80% of those to 90% of those turn out to be fine, but 10 to 20% of them do proceed to biopsy. September of 2010, the Affordable Health Care Act basically stated that women above the age of 40 are entitled to well care visits, which include routine visits to their OBGYN doctors, as well as yearly screening mammography. They don't have to pay any co-payments or anything, so they're entitled to those services. One of the major advances in treatment is breast conservation surgery, meaning that women who are diagnosed with breast cancer in the olden days were dreading the fact that they'd have a mastectomy or a large excision. We, with our team of surgeons, minimize the amount of breast tissue taken out, as well as with the localized radiation therapy. Breast cancers within a 5-centimeter area of the breast can be taken out surgically, and then the surgeon puts in a radiation probe and gives localized radiation to the breast over 5 days, rather than getting the month-long external radiation. So it's much better for the patient, and the patient's breasts don't get burned, etc.
You may recall that in a New York Times op-ed titled "My Medical Choice," actress Angelina Jolie revealed she underwent a preventative bilateral mastectomy after discovering she carried a mutated BRCA1 gene. You'll learn more about their services, past stories, and their commitment to increased breast health awareness when you visit the Waterman Digital Mammography StoryLink icon, Gene Mutations, online at yourhometownhealth.com.